After we understood this process of gas transportation, how we are moving CO2 from the lungs to the blood and vice versa for the oxygen, we need to understand that because of the control of the lungs of CO2, it means they can influence this reaction. The lungs can influence this reaction by CO2 because they have kind of a control of the amount of CO2 in the body. If we are breathing fast, it means we will have less CO2. If we are breathing slow, it means we will have high CO2. Remember earlier we said the plasma can handle only 7%, can have only around 7% of CO2. And this is like a homeostatic issue. So if we have more than those 77%, like 8 or 9%, it means I have to hide them, and it means I have to make this reaction go toward producing the bicarbonate. If I have less than 7%, then the reaction should move into the opposite direction because I need to bring them back. But there is an implication of this reaction. This movement of the reaction or of the equation left or right, it means I'm either bringing or taking hydrogen ions from the plasma. And if you remember, hydrogen ions would affect what? Would affect the pH of the blood, because pH is measuring the concentration of those hydrogen ions. If you remember, we have the pH scale from 1 to 14. 7 is neutral. The blood is here between 7.45 to 7.55. Slightly basic. Hydrogen ions will be high here. Hydrogen ions will be low here. Therefore, this is acid, okay, and this is base. And in order to prevent, if you remember from AB1, in order to prevent the changes in the pH, we need a buffer system. What is the buffer? It's a weak acid that can gives or takes hydrogen ions from the solution. Which is this? This is the buffer system. And in fact, this is the main buffer system in our body because it controls the concentration of those hydrogen ions. So now this reaction would happen because of CO2, this is one way, or because of the hydrogen ions as well. But for now, since we are talking about the lungs, we will just focus on the CO2, how the CO2 levels would affect hydrogen ion concentrations. Therefore, let's go back to our drawing board. I will have this reaction written here. CO2 plus water gives carbonic acid, which will get broken into hydrogen ions and biocarbon. And down here, I will have the same reaction, but written in the opposite direction. For simplicity, I'm splitting them. In the slides, both of them are inside the same equation, okay? But here, for simplicity, I'm splitting them. Okay, let's see the first case. In case we have hypoventilation. Start with the hypoventilation. What does it mean, hypoventilation? It means low breathing. What does this mean? It means not so much CO2 released. It means CO2 levels in the blood go high. So imagine here that I'm having high CO2 levels, more than or beyond the 7%. In this case, I need to hide some of those CO2. So I will move the reaction into this direction. But this means I'm going to release hydrogen ions. Okay? If you remember for the pH, so that's 1, 14, 7. It is acid, it is base. And hydrogen ions will be high in the acid part and low in the base part. So here, back to this equation, what's happening is I am increasing the concentration of hydrogen ions. In this case, I will get something called respiratory acidosis. In case hypoventilation. So hypoventilation will cause respiratory acidosis. Why? Because I'm accumulating CO2 in the body, in the plasma, and therefore the plasma need to get rid of this CO2 by moving the equation into this direction to release the bicarbonate. Remember, the CO2 is hidden here in the bicarbonate. But as a result of hiding the CO2, I will get into another problem, which is increasing the hydrogen ion concentration, and that will be the respiratory acidosis. Okay, what about hyperventilation or the fast breathing? What does it mean? It means I'm releasing CO2 too fast, okay? Which means low levels of CO2. So here I'm losing this CO2. Think maybe it's 6% now or 5%. The plasma will say, no, this is too low. We need some of the CO2. From where we will get it? We will get it from this. So in this case, I will move this equation into this direction, okay? To compensate for the CO2. But as I'm moving here, we will take those hydrogen ions. We'll take them out and put them in the water. This means I'm going to drop hydrogen ion concentrations. And therefore, the low hydrogen ion concentration, it means we are moving toward more alkaline value or basic value. So the hyperventilation will give me or will cause respiratory alkalosis. Hyperventilation will give respiratory alkalosis because we are trying to compensate for the CO2, and in order to do that we need to take the bicarbonate. But taking the bicarbonate, converting it to CO2, it means we will consume the hydrogen ions. Therefore we will have a drop in the hydrogen ions, drop or increase in pH value, and that is the respiratory alkalosis. Over here it was the opposite. Hypoventilation will give us high CO2 levels. In order to take them out, put them in the bicarbonate, we'll get the hydrogen ions. So here hydrogen ions levels will go high, which will cause a drop in the pH value, which is the respiratory acidosis. Always the concentration of hydrogen ions are inversed with the pH value. This is the pH scale. More hydrogen ion concentrations, it's less the pH. It will be more acidic, but the pH value is less. Okay? So that is for the respiratory alkalosis and acidosis. And we will come back to this when we talk about the fluid. Okay, now some of the diseases of the respiratory system, there are like several types of diseases or several groups. One prominent group of them is the COPD, which is the chronic obstructive pulmonary disease. And here what's happening from the name, that we will have something obstructing the lungs. Most of the time, it's the mucus. So this is a healthy lung, this is a defected lung with COPD. So what's happening here, that the airways are filled with the mucus, maybe because of inflammation, or maybe because of irritation, or maybe because of smoking. So those bronchus will get filled with the mucus. They will lose their ability to squeeze this mucus out. Okay, so this means that breathing process will become extremely difficult. That air would remain inside the lungs. So that is the COPD, which will cause difficulties in breathing, like sometimes wheezing or whistling sounds while breathing. Okay, and this will cause several sets of problems. Another form of COPD is emphysema. In emphysema, what's happening here is that there is the destruction of the elastic fibers surrounding the alveolus. And therefore, those alveoli would lose their ability to recoil. So they will expand, but without the ability to recoil. That's why they will get enlarged. So emphysema as a condition, it involves like enlargement of the lungs. Okay, some patients have to go through a surgery to remove some part of their lungs because it's too big. And those people usually are the ones that will get oxygen. They will have, attached, they have to carry an oxygen tank with them all the time. Sometimes some of them, they have the tube into their nose to put oxygen there, because the lungs cannot squeeze to get this oxygen or to get the CO2 out and get oxygen in. Therefore, we are kind of forcing oxygen into the lungs. So this is how emphysema. The other form of COPD, which is the chronic bronchitis, which is that, as we talked about, the accumulation of mucus and blocking the airways. Sometimes there are a chronic form of it and there is acute form of it, but in general, both of them would have the same conditions, accumulation of mucus. Those patients will have to take inhalers. Those inhalers will dilute this mucus, or sometimes they will cause dilation of those bronchioles in order to open up some space and allow air to move. Then there is another big group of diseases, which is the lung cancer. Lung cancer, 90% of all cases are resulting from smoking, and it is a leading cause of death in the US. We have three common types. We have adenocarcinoma. This is around 40% of the cases. Then we have squamous carcinoma. This is 20 to 40% of the cases. And then we have small cell carcinoma. This is less than 20% of the cases. The differences between them is the originating cells. What cells, or where are the cancer cells? Where are they going to develop? Okay, the adenocarcinoma mainly alveolar cells, whereas the squamous cell carcinoma in the bronchial epithelium. Whereas the small cell carcinoma, sometimes the lymphocytes or the macrophages inside the bronchiole, sometimes those are a result of metastasis. So treatment will include radiation, chemotherapy, sometimes surgery. There are always new treatments coming, but in general it's a tough disease, and survival rate is not that great in lung cancers. Okay, so that's it for the respiratory system. Please let me know if you have any question.